Chronic disease gets a big boost from lifestyle issues. Diabetes Triple Check helps you prepare your patients for a much healthier lifestyle. Patients first use the app, and their second opinion is with you, their doctor. When you start pre-screening patients in your lobby, you will find many needing a healthier lifestyle. In the USA, 1 in 3 adults already have prediabetes. We know unchecked where that road goes. What stops your patients from getting help? New changes provide no-cost help for them. The best path is pre-screening patients for diabetes and stroke risk. It's too easy to forget about a family history or just one key indicator. Simply use the Diabetes Triple Check app right in your waiting room. Your patients are engaged about their lifestyle right before their appointment, making it easier to get traction on their solution. You may think, so they are aware, but what will this app tell me? And that's a reasonable question. Let's look at the results screen on the right. You see it once the patient completes the questions. The yellow tag with the 1 is where we show body mass index, or BMI. Right of that is item 2, where we translate the BMI number into a weight status. On the far right is number 3. Daily aspirin use is asked per the U.S. Prevention Services Task Force recommendations. Next line down, item 4. Their risk using the stroke scorecard from the National Stroke Association. Within the stroke questions, we ask about smoking. You find number 5 as a reminder to the patient. Number 6, we have the diabetes section, which is the risk score from the Bang tool. Below that is 7, the CDC's pre-diabetes risk screening score. Below that, item 8 is the risk from the diabetes risk calculator. And below that is item 9, the overall average of those 3 diabetes tools. On the far right side of the diabetes section is 10, where we indicate if a patient is Medicare diabetes screening eligible. Nearing the bottom of the screen is item 11, where we include the note from the diabetes risk calculator. And just above the red banner, item 12 answers patient qualification for the new cardiovascular prevention of intensive behavior counseling. Under the ACA, health plans must adopt this as a no-cost option in their plans. Using Diabetes Triple Check, you don't have to ask tedious questions. Most patients will use the app and answer the questions by themselves. Now you can address much more than their current sore throat with every visit. Up to a dozen items on the results screen to help with U.S. Prevention Service Task Force recommendations gives you risk scores for stroke, diabetes, and lastly, no-cost program eligibility information. One last thing. When patients use their own smartphone, the Diabetes Triple Check app also contains your contact information. How many new patient referrals will you get? Register your clinic or medical office for free at www.diabetestriplecheck.com.